Good afternoon, everyone. This is Eric Devine for CIPHI Ontario branch here at Public Health Ontario in Toronto. I'd like to thank Public Health Ontario for co-hosting with us and providing us this platform, and welcome all of those folks that are on the line today. Our presenter today is Ofelia Tatar. She will be presenting remotely. There is no on-site presence today. And I did want to just take care of a couple of housekeeping items. I did want to remind all of those inspectors that are interested or maybe in the Toronto area tomorrow night that CIPHI Ontario branch and Ryerson University have partnered together to present Pubs with PHIs tomorrow night at 6 o'clock at Raymond Rye VIP room at Ryerson University. This is an opportunity for students to engage with professionals practicing in the field, and an opportunity for those professionals to pass on their knowledge and share their career path with future PHIs. And the last thing I would ask before we kind of get rolling is that for those people that are on the line, if there are multiple people in the room, please indicate the number of PHIs, the number of people that are in the room with you, just so that we can track the numbers throughout the series. So today, Ofelia Tatar is going to be presenting on the implementation of admission standards in Ontario's Class A public pools, where she conducted an exploratory study. Ofelia is a recent graduate of the Fast Track Public Health Program at the School of Occupational and Public Health at Ryerson University. In 2015, she was a summer intern student with the Ministry of Health and Long-Term Care Public Health Division, where she gained experience in environmental health policy and program work. In the summer and fall of 2015, she held a practicum position with Peel Region General Programs, where she acquired valuable practical knowledge related to food and water safety, health hazards, IPAC, and communicable diseases. She successfully passed the Board of Certification exam in October 2016. Congratulations to you. And secured a contract position as a public health inspector with Peel Region in the environmental health general programs. So without further ado, I will pass it over to Ofelia and remind everyone that we will be in lecture mode for the duration of this presentation. If you do have any questions, please indicate them in the chat pod on the bottom of the right-hand screen. Thank you and welcome, Ofelia.
Hello, thank you. I'm Ofelia Tatar, and today I'll be presenting the results of a research study related to the implementation of admission standards in Ontario's Class A public pools. Research made possible through a collaboration between Ryerson University and the Lifesaving Society. The educational objectives of this presentation are to provide an overview of the public health issue of recreational pool drowning in children and the admission standards developed to address it, raise awareness of the various anti-drowning strategies and public swimming pool supervision standards used nationally and internationally, and present and discuss details of admission standards implementation at operator level in Class A public swimming pools in Ontario. We will start by establishing the background related to the development of admission standards by exploring child supervision standards in several jurisdictions, as well as various anti-drowning strategies, and we will continue with the actual study from objectives to conclusions and recommendations. In the Canadian context of recreational water safety, drowning emerges as the primary cause of accidental death in children aged 1 to 4, and the second leading cause of preventable death in children under 10. The burden of illness is much greater, though, with 6 to 10 times more children experiencing near drowning and requiring hospitalization, and 1 in 4 sustaining permanent brain damage. Research shows that the main contributing factor in fatal water incidents is the lack of adult supervision. This finding is also revealed by several Ontario coroners' inquests into the accidental drowning deaths of children, and supported by data from the Canadian Red Cross showing that of all children under 10 years old who drowned, 3/4 were not accompanied by an adult. And what's surprising is that while parents in Canada recognize adult supervision as crucial to avoiding water-related injury and death, only half admit that they constantly supervise their children around water. To mitigate this risk and further reduce or possibly eliminate preventable recreational water-related deaths, admission standards were developed by the coroner's office. They are primarily intended for Class A pools, but can also be used to guide safety policies in Class B pools. Specific child-to-parent guardian supervision ratios are the main component, but other elements are also included, such as the facility swim test, staff training, public communication, signage, or tracking standards. Admission standards are not part of legislation, and their implementation is voluntary. In the 2010 Drowning Vet Review, Ontario's Chief Coroner's Office called for a concerted anti-drowning effort from various stakeholders at different levels of jurisdiction and suggested appropriate courses of action for each of them. As depicted in this slide, all levels of government are included, from municipalities to various provincial ministries and federal agencies. Non-governmental organizations such as the Lifesaving Society or the Canadian Red Cross are also called upon. The coroner's recommendations for the Ministry of Health and Long-Term Care relate to admission and tracking standards meant to increase direct supervision of young children, in particular non-swimmers. Here you can see the ministry's supervision ratios that are based on the coroner's recommendations. As one can observe, the coroner's standards are more stringent in terms of ages for children and guardians, as well as the use of personal flotation devices. When we did this research, we came to the conclusion that the main issue with admission standards is that they are not part of legislation, and as of 2016, their voluntary and discretionary implementation by public pool operators was not comprehensively evaluated. In Ontario, Regulation 565 public pools sets out the safety requirements for public pools, including the presence, number, qualifications, and duties of lifeguards responsible for patron supervision. However, the regulatory provisions of lifeguard supervision are not intended as a substitute for the parent's supervisory responsibility toward their child. Beginning in November 2015, the Ministry held consultations with key stakeholders on the modernization of safe food and water regulations, and consideration is given to child supervision standards under the current regulatory review. In Ontario, at the Ministry's request, the provincial boards of health, through their public health units, promote the use of admission standards to all inspected public pool operators, while underlying their importance in reducing the risk of water-related incidents. Since the Ministry's recommendations represent only a minimum standard, several public health units, as well as public pool operators, have chosen to promote and apply stricter rules. A scan of public health units' websites revealed that a multitude of promotional approaches related to these admission standards is used, through routine pool inspections, inclusion in the operator's manual, awareness campaigns, exploratory web pages, etc. The provincial scan also brought to light, as you can see here, a variety of admission standards criteria, such as child guardian ratios and ages, swim tests, tracking standards, the use of personal flotation devices, etc. And here are some illustrations of different signs used by public health units and pool operators, with some being more visually effective than others. A national jurisdictional scan showed that of the 13 Canadian provinces and territories, only Alberta had adult supervision of children incorporated in its legislation as of 2014. The pool standards require the development of a pool safety and supervision plan based on the Lifesaving Society's best practices, that consider the bather's age, swimming competency, and adult oversight, as well as they're related to patron education and notification. Moving forward, recommendations for supervision ratios are found in the guidelines for pool operations in British Columbia and Ontario's admission standards. What we found was that while the other provinces and territories, for those, the legislative reference to adult supervision couldn't be found other than by lifeguards, many public pools across Canada have voluntarily adopted various child supervision ratios. An interesting finding was that Nova Scotia's operational guidelines for aquatic facilities recommend the incorporation of drowning detection computerized technologies into the aquatic safety plan as an aid for lifeguards. Examples of international jurisdictions with a variety of supervisory ratios include Australia with the guidelines for safe pool operations, the European Union with the European Basic Guidance for Safety in Swimming Pools and a European standard, as well as the United Kingdom with the guidance document and a swimming pool child admission policy. This slide illustrates different child supervision ratios applied in the United Kingdom at various levels, Lifesaving Society level, and operator level. To determine the usage of supervisory ratios and other measures aimed at reducing water-related incidents and improving child safety, 39 peer-reviewed articles were selected and studied, each addressing a number of anti-drowning interventions such as adult supervision, lifeguarding, swimming skills and water safety education, environmental modification, technology, and legislation. Among those, adult supervision of children, which is also at the core of admission standards, was identified as instrumental in drowning prevention. Furthermore, it appears that direct supervision or within visual, auditory, and arm's reach is most effective when tailored to the age and developmental stage of the child. Research equally confirms the critical protective role of lifeguarding. As this is a highly demanding activity, staff attention needs to be fully dedicated to swimmer safety. While supervised pools are extremely safe recreational environments, lifeguards alone cannot ensure absolute safety, leading researchers to the significant conclusion that supplementary measures of safety are desirable. Acquiring swimming skills and being educated in water safety practices early in life are also recognized as important prevention elements. Complementary measures in the form of improved environmental pool design, especially when legislated, result in controlled access and improved supervision. Anti-drowning technologies are intended as a complementary aid for lifeguards and not as a substitute, and they vary from simple automated physical barriers to complex detection and signaling systems. In regards to legislation, research shows that drowning death rates decrease post-implementation of related acts and regulations, while emphasizing that additional preventive strategies are needed for long-term results in the form of continuous advocacy, public education campaigns, or compliance via enforcement. This slide illustrates two newer anti-drowning technologies. On the left are the programmable wristband and underwater pool sensors from Centag, and on the right are the computer-aided drowning detection structure from Poseidon, which integrate artificial intelligence software with video camera vision to process aquatic images. Now that the context to child supervision standards was established, we will continue with the study we've conducted last year. The primary objective of this study was to explore emission standards implementation in Ontario's Class A public pools as of February 2016. A quantitative study, as well as survey, with a minor qualitative component, open-ended feedback, was proposed to carry out the research. The survey was intended for Class A public pool owners, operators in Ontario. On behalf of the research team, a recruitment email was sent by the Lifesaving Society to 277 of its Class A public pool affiliates offices in Ontario. Using SurveyMonkey, a 20-minute online de novo questionnaire was designed to explore groups of variables such as pool characteristics with type, location, and various operational details, admission standards with child-parent ratios, staff training, efficacy, etc., or operator feedback with implementation challenges and successes or support for legislation. 30 questions with varying response options were developed, pre-tested and adjusted based on the feedback, and ethics approval was obtained from Ryerson's research ethics course. Data analysis was performed using Microsoft Excel. Respondents with significantly incomplete answers were excluded, and mostly descriptive statistics were used to report the results. Out of the 277 emails that were sent, 139 responses were received, out of which 114 were selected for analysis, yielding a response rate of 41%. Those 114 surveys accounted for 145 pools. Moving on to the findings of the study, most respondents were found to hold a supervisory and/or managerial work position in which they worked for 5 or more years. Regarding pool parameters, results suggest that pools are evenly located in large urban, medium, and small rural population centers. 2/3 are the indoor type, and nearly 90% have more lifeguards on staff than required by law. Regarding admission standards, all respondents claimed to have those standards integrated in their normal pool operations. When responses are categorized by level of supervision ratios, you can see on the left, 68% exceeded the ministry's recommendations, and similar results can be observed for the age of the guardian on the right side, with 60% having a requirement of at least 16 years of age. This bar graph depicts the usage of various components of admission standards other than ratios. Some of the top components used by more than 50% of pools are posting of signage at reception or deck area, pre-screening at entry, sorting of children by swimming ability, using a visual recognition system, and postings on the company's website. The least used components were the buddy system and body measurements. This graph shows the distribution of pools by how staff training related to admission standards is delivered, such as through staff books, policies, and procedures at the beginning of employment or annually. The left side pie chart depicts the enforcement of admission standards when supervision ratios are not met, indicated that when this occurs, the majority of pools, 86%, do not grant admission to their patrons. The right side pie chart shows the distribution of pools by the overall number of water-related safety incidents, for instance, slips, falls, near drowning or drowning occurrences, after the implementation of admission standards. As one can see, no pools reported an increase, and 35% reported a decrease in incidents. When it comes to operator feedback, The most frequent implementation challenges were increased processing time for 67% of pools and negative public response for 58% of pools. Less than a third shows increased costs and staffing as a challenge. Other challenges captured under the open-ended response category were, and I quote, how to educate staff on the importance of enforcement, how to deal with disgruntled patrons, how to educate the public, and another one was the lack of standardization across pools that leads to customer complaints. In terms of successes, the vast majority of respondents pointed to improved safety and the fact that it's easier for lifeguards to supervise bathers. About a quarter also chose increased reputation and good advertisement tool as a success. Other successes captured under the open-ended response category were, and I quote, it has decreased the number of young and or non-swimmers being dropped off at the pool and left for us to babysit. Another one was people understand that we take safety seriously. It is a great tool to educate parents on the risk. And another one was a greater sense of responsibility placed on bathers' guardians. Despite encountering challenges in implementation, the majority of operators, as seen here, 87%, described the overall impact of admission standards on their operations as positive or very positive. Approximately 3/4 of the respondents indicated that lifeguards' feedback to admission standards was positive or very positive, and less than 1/4 indicated that the public's feedback to admission standards was negative or very negative. This slide shows the distribution of pools whose operators would like admission standards to be mandatory, indicating a strong support for legislation in more than 3/4, 78% of cases. Also, a few associative statistics were attempted, as seen in the next 3 slides. What we wanted to see is if there's any statistically significant association between admission standards level and pool location, as shown in this slide, between admission standards level and water safety incidents pre and post implementation, and between the admission standards level and water safety incidents. The other one was like the level and type of implementation challenges. Now, those results will be discussed a little bit further when we will interpret them as well. To summarize, 2/3 of pools were the indoor type. Pools were relatively evenly distributed among large urban, medium, and small rural population centers. The fact that 90% of pools had more lifeguards on staff than required by law could indicate that improved safety is of great importance to operators, as well as a need to lessen the pressure on staff related to the implementation of emission standards. 100% of cases had emission standards integrated in pool operations, and this could reflect a true increase from 2011 when 96% of Class A pools had some form of emission standards, or it could be due to the fact that respondents were Lifesaving Society affiliates. 50% of operators claim that they were informed about emission standards by the local public health unit, and in 53% of cases, the decision to adopt those standards was not influenced by the public health unit, possibly due to the fact that Lifesaving Society advocated admission standards prior to public health units, and that respondents were Lifesaving Society's affiliates. About 2/3 of pools used child-parent ratios and ages of guardian that exceeded the ministry's recommendations. This is perhaps a reflection of these recommendations being seen by operators as insufficient. This could also reveal a heightened understanding of the crucial role of adult supervision in the prevention of recreational water incidents in children. In addition to a wide diversity of supervision ratios and ages of guardians, other components are used in different combinations of more than 50% of pools. And some examples are pre-screening at entry, sorting of children by swimming ability, using a visual recognition system, posting of signage on premises, etc. This assortment of requirements and their combinations shed light on the lack of standardization across Ontario, which was identified by operators as a contentious point in their relationship with the public, and might explain their apparent strong support for a unified legislative solution. Admission standards were integrated in a multitude of regular staff training procedures at more than 75% of pools, and they were enforced in 86% of pools by denying entry when required child-guardian ratios were not met. This indicates that operators are clearly committed to building proper skills for their staff, as well as to thoroughly applying the standards, despite added procedural complexity and the risk of losing some of their business. In 60% of cases, there was no evaluation of the effectiveness of emission standards, highlighting the need for an evaluation strategy. No pools reported an increase in the overall number of water-related safety incidents pre- and post-emission standards implementation, and about a third reported a decrease. However, it is unclear whether there were actual decreases in water-related incidents, and a long-term study is recommended to confirm this. In terms of operator feedback, over 85% of operators described improved safety and help for lifeguarding as top successes, suggesting that emission standards meet their intended purpose and that they are contributing to increased lifeguarding performance. For 50% of respondents, increased processing time and negative public response were top challenges. However, it seems that these challenges are manageable and outweighed by successes, possibly explaining why the majority of operators describe the overall impact of emission standards on their operations as positive or very positive. This finding was echoed by the fact that almost 3/4 of lifeguards' feedback was positive or very positive, while only 22% of public feedback was negative. In terms of associations, pools located in large urban and medium-sized population areas seem to be more likely to exceed the ministry's recommendation, so the association was statistically significant, raising the issue of resources availability and knowledge translation in rural areas. Pools with stricter emission standards were not more likely to encounter implementation challenges than pools with less strict admission standards, so the association was non-significant statistically. But this leads to the interesting idea that there was no added operational burden when minimum requirements were surpassed. When comparing pools with different levels of admission standards, there seemed to be no statistically significant difference in the number of water-related incidents pre- and post-implementation, although this could be due to the small sample size. In terms of the study's critique, some of the biases identified are linked to the selection process, type of survey, and respondents, but nevertheless, the study and its distribution were designed to minimize those biases. Potential errors related to questionnaire design and interpretation, as well as data analysis, were also identified, and verification processes were used to ensure accuracy. For limitation, the most significant was the constraint of time and human resources, which reduced the scope and range of exploration. The exclusion of Class B pools was the biggest one. These Class B pools, although they account for most drownings in public pools, they were not included in our study, primarily due to the limited resources. This can be addressed by further research done by the Lifesaving Society in collaboration with Ryerson University, perhaps. Because these pools are unsupervised, admission standards implementation and enforcement would be difficult to assess, raising questions about the type and quality of data collected. And also, just food for thought, could this be an appropriate place for anti-drowning technologies? Other limitations were that the survey did not account for multiple pool responses per one operator. The data was self-reported, i.e. not verifiable. The primary focus was on child-parent ratio, and that the open-ended responses from operators were not included in the analysis. The current study provides an initial insight into the state of emission standards implementation in Ontario's Class A public pools. It describes a recreational water environment in which a coherent safety intervention is voluntarily adopted at a remarkably high rate, with challenges being balanced by successes. In many cases, this implementation precedes the ministry's initiative in time as well as in complexity. The operator's approach to surpass the minimum requirements suggests an elevated awareness regarding the importance of adult supervision. An important conclusion is that owners and operators would be amenable towards legislated emission standards. And this is considered under the current regulatory review done by the ministry. This study's findings could be used by public pool operators, prevention leaders, and policymakers with the goal of preventing the burden of illness and injury related to recreational water use. And although admission standards appear to be effective and their uptake is positive, more research is needed to be conducted for conclusive results. Such future research could improve the questionnaire and adjust the study to Class B public pools, could include actual water safety incidence data and examine time trends. What we found from the Lifesaving Society was that this data about the safety incidents is not collected throughout the pool environment, and there isn't a master database where this information can be found, so it's pretty hard to come by. Also, evaluate and compare pools with emission standards implemented versus pools without. Explore operator procedures for the evaluation of these standards, and include operators' feedback into a future legislated solution. In addition to admission standards, a variety of anti-drowning initiatives could be employed to ensure an effective prevention strategy. And when developing these strategies in Ontario, the reality and particulars of an increasingly diverse population would need to be considered, and the intervention and its execution ought to be culturally mindful in order to be effective. To conclude, I'd like to thank Michael Shane and Natalie Valliere of the Royal Lifesaving Society of Canada, Ontario branch, who assisted with the dissemination of the survey, as well as all the Class A public pool operators who completed the survey and provided valuable feedback. For additional information and details related to this project, here's my contact information. And the last couple of slides. are with the references in case you wish to consult them later on. And with this, our presentation concludes. Thank you very much for your time and attention.
Thanks, Ofelia. That was a great presentation. I really appreciate it. I'm going to give a few moments for people to script questions that they may have. In the meantime, I will remind all those on the call that the slides will be posted to the CIPHI Ontario website promptly. And we do also record these sessions and will post the video and commentary of this session to the CIPHI Ontario YouTube channel, which can also be accessed through the CIPHI Ontario homepage. I'll also remind those people on the line that the seminar series will be in hiatus in April due to the Ontario Public Health Conference. If you haven't got your tickets, please attend now. Look forward to seeing you there. We will return in May with another recreational water seminar where Fatih and Anne-Maria are going to present on the regulatory training program for pool and spa operators. It will dovetail nicely into Ophelia's presentation. Ophelia, while we're waiting for other questions to populate, I did have one about your drowning rates, and in your scan, did you notice any difference in the rates when you compared them to, say, the province of Alberta, which has mandated adult supervision, or in other jurisdictions? I recall Australia was one of them. Did you notice any difference in the drowning rates?
We didn't actually compare those. What we compared were the child guardian ratios. So the study was not geared towards the actual data about the drowning incidents or water safety related incidents. It was more about the emission standards, particularly those child-parent ratios and their implementation. But in terms of those, I can tell you that the ratios across Canada vary slightly from what our coroner recommended and from what the ministry recommends. But what I found internationally was that an interesting idea popped up, and that was of the risk assessment. So in other words, they have some ratios that might be more stringent than ours, but depending on the situation, so for instance, if the pool is just a regular pool, there is a certain ratio. If that goes to a wave pool, then this ratio is decreased. So they're also doing a kind of real-time risk assessment. And then another interesting issue was that in Europe, they seem to have defined the role and the competencies of the guardian or parent much better. So they're saying that adult supervision means within arm's reach and within visual and auditory immediacy. And also those guardians need to be proficient, be able to swim, be able to provide help if needed. I don't know if that answered your question.
No, appreciate it.
Yes, in terms of, sorry to interrupt, in terms of the drowning data and the incident safety, water safety incidents data, what Michael Shane told us from the Lifesaving Society is that the collection of this data is not done in a systematic manner, and there is no master database where you could access this.
Thanks, Sophia. I just have a follow-up there as well. If you could please provide some details about how you selected your pool for the survey, and how did you operationalize contacting all of those people?
Yes, so as I explained in some of the slides, one issue that came up when we were designing the study was how to get the survey out there. And through the collaboration with the Lifesaving Society, that was the best way and the fastest way we could get in touch with the operators. So what we did, we designed this email, and the Lifesaving Society distributed to their affiliates, to 277 of those affiliates, swimming pools, Class A swimming pools, through a secure email. We didn't have access to that, so they did it because they didn't want to give us access to their affiliates' information. So Lifesaving Society distributed those 277 emails, and out of those 277, a certain number responded to us. So that was the way we selected our sample. It turns out, like initially we thought that one email will go for each pool location. That's why we didn't provide for, in our survey, for a question that would clarify how many pools you're responding for as an operator. So these 277 emails might have accounted for, I don't know, 400 pools for what we know. And in some of the responses, they did say, oh, I manage 6 pools or I manage 7 pools. And so that's how we found out that there was actually more pools than responses.
Thanks. Sorry, apologize for the bell in the background. There's a fire alarm going off here at PHO, fire test. Thanks, Ofelia. I appreciate your response. And what it reminds me of is another example of where public health inspectors collaborate with a wide range of partners across the public health spectrum. We've seen in other presentations where health inspectors will contact other health inspectors, other jurisdictions. We've partnered with business communities, and then this is just another great example of how PHIs reach out to try and help protect the health of the public. I don't see any other questions here in the chat pod at this time. So with that and the buzzing in the background, I think that we will express our thanks on behalf of CIPHI Ontario branch, and Public Health Ontario expressed my thanks to Ofelia and all of her collaborators in putting this presentation together. And we look forward to seeing everyone in May. Thanks very much, everyone. Have a good day.
Thank you, everyone. Bye-bye.